This is Deanne. I'm going to switch over to my computer in just a few minutes, but I am here as well.
Great.
Okay, we gotten all our messages. All right, good morning, everyone. Can you all hear me?
Yep, can hear you. Good morning.
All right, very good. Well, welcome you. Welcome the people joining us all across the state. Appreciate your attendance at our Children's Cabinet meeting today. Just a second here. There we go. I guess the first thing to do is to take a look at the minutes of our August 5th meeting. Are there any additions or corrections to suggest to those minutes? I guess I'll ask for a motion to approve the minutes.
This is Delise. I move to approve.
Thanks, Delise. A second?
Second, Lietta.
Thanks, Lietta. Moved and seconded. All in favor, you can say aye. Aye.
Hi.
Aye.
Are there any opposed? All right, we clearly had a unanimous vote. There were no opposition. We have a rather short agenda today, I believe. So we'll just kind of move right into it. We're hearing, I think I'll let you introduce this, Melissa, if you don't mind.
Great. Communities in Action is a project that we wanted to bring not just to the cabinet's attention, but the public that follows along the work we do. We wanted to feature the work that has been going on under the leadership of Child Care Aware. Kelly Davidoff, the executive director, is here with us, and she's joined by Sarah Wassinger, the president and CEO of the Hayes Chamber of Commerce, as the representative of one of the communities that has been part of this program that is going on. And I won't step on the presentation, but it's happening across the state in multiple communities, and they will present a look at how we are helping support communities with the question of how to address the childcare needs. Really, in some ways, a crisis. So, Kelly, I will turn it over to you and Sarah at this point, and we can take questions when you're done.
Thank you, Melissa, and thank you to the Cabinet for the opportunity to join you here today. Sarah and I'll offer on behalf of both of us, are very excited to join you and to share a little bit about the work happening in communities across Kansas to address access to affordable, high-quality childcare. So I'm going to kick us off with just a little bit of information about what Child Care Aware of Kansas is doing to support this work. But perhaps more importantly, we're going to give Sarah an opportunity to talk to you directly about what's happening in the community of Hayes and dive into some of the details around the work that they're doing there. So I've provided just some contact information for both myself and for Sarah. If you're interested in learning more after this presentation, you're welcome to connect with either of us, and we would be happy to talk further. Next slide, please. Thank you. So just to start off, Kansas is working in communities across the state to support access to affordable, high quality care, as I mentioned. We have established and expanded an approach that really builds off of the idea that solutions and innovation to childcare happen at the local level. And we really want to support that as a statewide nonprofit. So our approach really centers around supporting, partnering, connecting communities to resources, and just overall working alongside communities as they're addressing childcare challenges. So we have 4 phases that we take when we work with communities to address their challenges. The first centers on some pre-planning support. So we work early early with communities as they're establishing perhaps a coalition or a task force at the community level, helping to identify key partners to bring to the table. We have some supports and resources that we can bring in early on to conduct surveys and needs assessments and really look at return on investment and building some key foundational understanding of the local childcare landscape. We from there offer the opportunity to participate in a structured workshop, and we call it the Communities in Action Workshop. But really what we're offering is an opportunity for communities to gather as a team, as a coalition or task force, with some structured planning time. It's not often that we have an opportunity to do that in a really concentrated and focused way. And this workshop is intended to provide that. So we'll bring in experts from across Kansas's early childhood system, whether it's to talk about licensing or how to access and incorporate childcare subsidy into planning, or how to incorporate the food program, all of those things that really are there to support local solutions to childcare. We also carve out time for those teams to work as a group to identify their short and long-term goals. And again, we really believe that the solutions are inherently there at the community level already. And our role is to provide space to bring those out and identify the assets that are in communities and work towards a plan to implement from there. So once communities have a plan in place, when they have short-term, long-term goals to expand childcare in their communities, we are able to offer some funding supports. This is a new opportunity that we actually are just launching this week on Monday, in fact. But we have an opportunity for communities to apply for some concrete funding support to make their local plans a reality. We have a couple of different grant opportunities. The first one is a smaller pot of money. It's about $2,000, and it's meant to support some early stage planning for coalition building. So a community that might be at an earlier stage of readiness can access some funds just to get up and off the ground, perhaps learn from other communities, get their feet wet in terms of addressing childcare challenges. For community coalitions that are a little bit further along in the process, they have goals in place, they've done the work, they've done the needs assessment process. There's a larger amount of money available to help them implement their goals, up to $45,000. And we really encourage communities to think about the holistic project or the holistic needs related to their childcare plan. So $45,000 might support part of a project, and will assist communities in seeking other funding to implement their full project. Then we also really try to offer some ongoing support to communities as they're working through implementation. Oftentimes we might run into a question or a challenge here or there as we're implementing plans at the community level. And so we provide support through Child Care Aware of Kansas as communities continue to work on their goals and their plans from there. Next slide, please. This visual gives you hopefully an overview sort of picture of where we are working in communities across Kansas. Child Care Aware of Kansas actually is part of a broader network of childcare resource and referral agencies. So we partner throughout the state with Child Start, Child Care Aware of Eastern Kansas, and the Family Conservancy. And you can see which counties we are working with on childcare solution building. And you can also, I think, based on those red dots there, see where we have offered a structured Communities in Action workshop to date, and also where we know that work is happening at the local level, but we're not necessarily engaged with the community's efforts. So as you're looking at this and perhaps wondering how you can get connected, these are the counties that we're aware of that have active childcare coalitions, and we're always happy to help connect interested stakeholders, partners, anyone interested in being involved at the community level. We can help connect you with the active childcare coalition in your area. Okay, I'm going to highlight just a couple of quick community stories and successes for you here, and then I'm going to definitely hand it over to Sarah to go more in depth with her success story. We've chosen just a couple of counties to highlight for you, but Marion County is one that we wanted to bring forward. This county formed a coalition in 2019 to look at their local childcare needs. They completed a needs assessment in 2021, and then they were able to participate in a Communities in Action workshop with us earlier this year in 2022. They are moving forward full speed ahead with their short-term and long-term goals. They're actually looking at formalizing their coalition as a 501c3 so that they can pursue funding. And they're working to secure a site for a new child care center in their community. We also wanted to highlight Stafford County for you as well. They have a coalition that is up and running, and they have plans in place to construct a modular group daycare home. They actually had the opportunity to present to their county commissioners about the landscape in their community. And as a result, we're able to secure some local ARPA funds to address childcare needs. And they're blending that with funds that they've already received from the city level as well. And currently they are underway. They've purchased property and are working to place that modular childcare classroom in the community. Then the last one I wanted to highlight is Edwards County. I love the image there of the community members breaking ground. One's even got a little one on her hip. But this is such an interesting and inspiring story. This community has really come together in so many different ways. In 2021, K-State Research and Extension worked with the community to open 3 childcare facilities in Kinsley. And then that, I think, kind of spurred the community to come together from there to form an active coalition with their local economic development director. And just recently in May, they broke ground on a 4th childcare facility in Lewis. And many of the community members came together with different pieces of the solution, either donating their time, their expertise, their labor, et cetera. And they're going to be putting a modular facility in place and opening that soon. So really exciting progress. And this is just a snapshot of 3 Kansas counties. There are so many more wonderful stories of success and learning and growth happening across the state. But these at least kind of get us kicked off in looking at 3 communities. So I'm going to pass it over to Sarah Wassinger now with Hayes and let her talk to you specifically about what they're doing in their community. Sarah?
Thank you, Kelly, and thank you for the opportunity to visit with you all this morning. Our Chamber of Commerce has been in existence since 1917, and our mission is to accelerate business connections and advocate community advancement, hence us being involved in our child care initiative in Ellis County. We do have a small staff of 4 full-time, and our conversations surrounding childcare really were birthed around our membership visits this last year in 2021. Almost every single visit that we had at that time with our members indicated a significant need for more childcare and the fact that they could employ people that were interested in taking jobs, but at that time they couldn't find access to quality and affordable childcare, so they had to turn down jobs at that point in time. That is where we really ignited and started the task force back in September of 2021. So we're just a little over a year into our efforts and are very excited. We just finalized our mission statement. Actually, and that mission is to create and maintain a sustainable quality childcare environment that assists in attracting employees to Ellis County while developing our children into the next generation of community leaders and workforce. Excitingly enough, they maybe don't attend every single meeting, but we have nearly 50 people so far who have engaged in our efforts, and that list kind of continues to grow on a monthly basis. So who is at the table? We've been very blessed to have Kansas Department of Health and Environment. I know Melissa Schoenberger is here today, and just wanted to say thank you. They have done a wonderful job helping us stay in alignment with feedback that we're receiving from current child care providers. Jennifer Burgart has been a relentless resource for us through Child Care Aware of Kansas. without her, I would say that we would still probably be back on square one or square two. So they have given us a lot of tools and resources in which we've utilized to kind of continue our work. We've also had a couple of center providers and in-home providers who are a part of our regular meetings and efforts. And then, of course, we have representatives from our 3 local school districts in Ellis County, which is how many we have. And then our 2 largest employers are Hayes Med and Fort Hays State University. We also have Barb Wassinger. She's our representative for the 111th district, who has been regularly attending. And then, of course, we would definitely be lost without the efforts of local employers and parents. And then Grow Hayes is our economic development entity. And we also have some various nonprofits at the table. So how did we get started and what were our first initial efforts? We knew early on, in order to identify what our true needs were, we needed to have a study done to figure out where Ellis County sat. So in November and December of 2021, we conducted that survey, and it told us a lot of different things about our community. We had about 800 people take the survey, and the most astonishing fact that we learned as a chamber from a workforce standpoint was that 150 people would return to the workforce if they had access to quality and affordable childcare. About 98% of those who responded to the survey identified a strong or at least agreed with the fact that Ellis County was underserved in childcare. And then it also showed us that 270 families that were surveyed through that process were actively seeking care and did not have access to that care. And so we currently to date, through our Child Care Aware of Kansas point in time data, are showing a need for about 640 spots as of this morning. So we still have a lot of work yet to be done. Next slide, please. So after we figured out what our true needs were, we figured it would be the best logical step for us to connect with our current providers, but also figure out who out there is considering opening up a child care in-home business or who might be willing to do work at a center-based level. So we had 3 different meetings in our county. Hayes is kind of the big brother, so we definitely wanted to make sure that we were meeting people where they were at. And so we had a meeting in Ellis and Victoria and in Hayes. And we actually connected with about 4 new child care providers during those efforts, and also had 18 current providers who attended. It was a great opportunity to just give them space to voice what their struggles are, their challenges are, and give them a voice for where they're at right now and figure out how we can not only support where they're at. We know that part of our success going forward is going to be to retain our current providers, but we also know that we need to work to identify who those new people could be coming into our community to offer childcare. And so that bottom right picture is actually taken from our Communities in Action workshop, which we also conducted in March. So those were some of our earlier efforts after our survey was completed. And then moving forward into the month of May, next slide, please. We decided that it would be a good idea for us to find some different ways to thank our child care providers. So we ended up doing an appreciation event for them, in which we had a couple of different things, and I'll get into that a little bit later. With those meetings that we had with our providers, though, we really learned what some of our challenges are. And so finding enough individuals who would be interested in opening up a child care business. Ellis County is a little unique when compared to other counties because we have fewer centers and more in-home providers than what most counties do. And so our model is actually opposite of what most communities have. We currently have 8 centers in Ellis County, as well as about 70 in-home providers. And when we visited with the current providers, the stress levels that they shared for having to operate a business out of their home was significant. And the fact that they had to turn around and be able to take care of their family in the home, some limitations for things that could or couldn't be in place during the day. They also shared some concerns about their own children being in the counts, and we very much talked about there's a reason for that, and it's because we want to make sure that all of the children in the home, whether they be the provider's children or the children that they serve, are well taken care of and are in a safe condition. Outside of that, funding obviously has been a significant challenge for us. We started these efforts not having any funding whatsoever, and so making progress on an issue when you don't have money to tackle the problem is very, very limiting. Livable wages for our providers, making sure that they can have money to take home to support their families, not just because they're trying to offer quality and affordable care. Where's that balance? And that balance has been very difficult for them to achieve, wanting to do what's right for their families, but also wanting to do what's right for their own family. And then essentially just getting our business community more involved. They want to be a part of this, but I think that they have questions as to what and how that could look like. And so really getting more of them to the table. And then there's so much out there right now for funding for childcare. And it's just really challenging to figure out how do you navigate through all of those opportunities? What should we apply for? What should we not apply for? Who's going to manage that work? Can we manage that work? And what would that look like? Next slide, please. So here are a few of the things that we've seen success with since we started over the past year. I did find out recently that one of the centers that was going to be opening with our letter of support actually may be questionable at this point, but to date, one of our letters of support that we wrote as a task force is opening up a center for Hayes Med, and they're going to be doing childcare for their staff. And if they have additional openings available, they will open those up to the community, and we're looking for that project to be finished by the early part of 2024. We were also able to have a couple of in-home providers start their businesses since we've been a part of this process. So we're very excited to be a part of that. She actually a couple of them regularly attended our meetings and aren't coming anymore because now they're busy during our meeting time offering childcare. We've also been able to acquire a $30,000 grant from one of our local foundations in town to complete an awareness campaign. Our challenge from them was to also find matching funds to pledge an equal amount of what they are offering. So again, just trying to figure out how we can get people to partner with us from a financial standpoint to do some of those things. And then we did apply for the Rural Champions grant, but received word this week that we were not successful in that effort. Some of our future things that we'll be working on here in November are having focus groups that will identify some concerns and gathering feedback from current providers again, our parents, our employers, our faith-based communities, and of course our schools that are here in Ellis County. And then of course, as well as that, applying for additional grants to help fund some of the different things that we've got going on right now. Our Early Childhood Connections Director, Donna Hudson Hamilton, is actually working with Hayes High School to add a CDA track for high school students so they can graduate with CDA certification. And that should hopefully be added to their curriculum as soon as next year. And then the creation of a child care benefits package. We're working with local employers to see if we could have some benefits specifically lined out for some of our current providers to make things more affordable for them, like maybe phone access, internet and things of that nature that they're already paying for, but help make that more affordable. And last but not least, we're working on a substitute pool to figure out how we can bring qualified and certified providers into the homes or into the centers to help alleviate those times when our current providers need to have appointments, whether that be with their children, their parents, or themselves. So we're trying to look at this with a holistic approach and just providing resources to our current folks, but figuring out how do we get other people engaged who aren't currently providing care.
Well, again, if you are interested in following up for more information, Sarah and I are both more than happy to connect and share a little bit more, and you see some additional contact information there. And then I also just want to share that this project is generously funded by the Kansas Department for Children and Families. So thank you for the opportunity to share.
Yes, thank you.
Thanks. Well, thank you, Kelly and Sarah. Let's see if we have any questions from cabinet members.
Kim, this is Melissa. I want to, DCF has been great at bringing funds to bear, but this was, the origins of this were PDG funded. So this is an example of how that planning grant and that the renewal of that grant have led to this amazing work that is now, you know, like we've been good partners among the multiple agencies partnered on the PDG work, and we appreciate DCF for picking up the ball and providing the funding to fuel the expansion of this program in the way that they have. So just wanted to put a plug in for the systems level work going on courtesy of PDG.
Thank you. Yeah, are there any questions?
Yeah, Kim, this is John Wilson with
Sure.
KAC. So Kelly and Sarah, thank you for the presentation. It's wonderful. And I've heard nothing but great things about the Communities in Action work. And I'm thinking about what's happening kind of in your area. First question I had was, do you have a sense of the number of providers who are enrolled in the subsidy program? And are there barriers to them enrolling in the subsidy program to kind of be another funding source? Maybe that's a Kelly question more than a Sarah question.
Well, I think statewide, and I might defer to DCF for the concrete numbers on this, but I think it's around 40% of our licensed childcare providers are currently enrolled in the childcare subsidy program. I think that that's a really important line of inquiry. And I don't know that I have all the answers or that I can speak for childcare providers on that piece, but I do feel like there is opportunity to better understand the provider experience for enrolling and participating in childcare subsidy, as well as on the parent side as well. Anything we can do, I think, to look at any system access barriers is well worth it, as subsidy is really a key component both of maintaining a childcare business and maximizing opportunities to have a solid business practice in place, as well as ensuring that families have access to high quality childcare.
Yeah, thank you. And one other question, if I may, Kim, is, I heard recently in the news kind of enrollment declines at Regents universities, and I think Fort Hays State was among them. And I'm just curious to know if there are, I don't know the demographic of student at Fort Hays State, but if any students are parents of young children, it might be hard to go to school if you can't find childcare. Sarah, can you talk about any dynamic that exists for students who are trying to get higher education so that they can have higher earnings and support their families, but can't find childcare?
Intriguingly enough, we are down about 10% this year for Fort Hays State University for their enrollment. I have not heard any of the statistics as to how many students would attend that are in need of childcare but don't have access to it. What I can share is that the Hays Area Children's Center and Tiger Talks are two of the main programs that actually provide care for students that go to Fort Hays State University. Hays Area Children's Center just lost their Part C certification because of a lack of funding, and that has actually transitioned over to Developmental Services of Northwest Kansas. And we are, in general, just having some center-based concerns with having enough people to actually provide care right now. And there's been a lot of transition in leadership and staffing. And that right now is actually the biggest problem, is how do we keep those facilities that are currently providing care staffed right now? And so I can't necessarily speak to how many people would or would not be able to access that care. But those are some of our bigger concerns right now, is just the location at the places that would be convenient to provide care for those families. They're seeing some significant struggles right now.
Okay, thanks, Sarah. Appreciate
And
that.
Sarah, to piggyback on that, I'm also from Hays, Melissa Schoenberger. We also do have early Head Start and a great program. And they have a great complex that would serve students, Fort Hays students specifically, because they would meet the criteria. We're always looking at how do we open up more classrooms to serve more students. So very significant, not just Head Start, but we do offer several classrooms of early Head Start. So that fills in some of the gap too.
I just had a question about home providers. I think I noticed that you're sometimes providing financial support for home providers to get into that. How is that really a significant barrier for people getting into the home care providing, sort of the startup costs or home modification costs, and what kind of dollars typically are involved in meeting that, eliminating that barrier? That may be a Kelly question.
Well, I'll start, but I'll invite input from others as well. So yes, you're correct. We do provide some startup support funds for professionals that are opening a childcare business. That is actually offered through our childcare health consultant network. We have a team of folks across the state that are there to work with anyone interested in becoming a licensed childcare provider. As they sort of figure out the ins and outs of opening their business, navigating the licensing process, and the concrete supports we have to support that are a small startup stipend. I believe it's $2,500, and it's really there just to help with basic costs of getting up and running. If there's a technology need, if there are other first business expenses to get started operating. And then we also offer health and safety grants for childcare programs as they go through the licensing process. If there is a barrier, in the environment, in the actual location itself, we work with programs very much on a tailored basis to provide supports, financial supports to remove whatever that barrier might be. So if it's a fence or a sprinkler system, something along those lines, they're smaller dollars, but they are there to support childcare programs and continuing to move through and quickly removing any barriers to becoming licensed.
Thanks.
I would also share that one of our new providers who attended the prospective childcare provider meetings, the one that had actually opened up a separate location outside of her home, but is providing care out of that facility. She looked at a lot of different avenues for funding when she was getting started. And that was probably her biggest challenge and hurdle, was the funding side of things, to make sure that she had all of the resources in place to be able to open up her childcare in-home.
Any further questions?
Kim, this is Melissa. I would invite Melissa Schoenberger, who is with KDHE from the Child Care Licensing Division, to weigh in if I miss anything or mischaracterize. But I would just say that the grant funding that is being discussed has been primarily from pandemic relief funds. We had some money early on from PDG that helped with get the Child Care Health Consultant Network. I think we blended in money together to support getting some things off the ground. But the grant funding that we're talking about right now is courtesy of pandemic relief funds that primarily DCF has received for the Child Care Development Block Grant funding, which has made a huge difference. Those startup costs for somebody looking to care for children in their home can be prohibitive if it involves some of the safety requirements to get licensed. Some of the training that needs to be acquired by the individual, some of the equipment that they need, because even if it's in their own home, there's certain equipment that has to be on hand, or certain arrangements of things that need to be done. There needs to be safe outdoor play space that might involve a fence around space outside. Melissa, I would invite you to embellish with any other information you think would help.
Also, Melissa, so I was getting ready to drop this all in the chat. So thank you for starting the conversation. We also cover through the funding the initial application costs. So that's a huge barrier that's removed right now. So we cover through the funding opportunities through the pandemic relief, the initial application, which can vary from a home to a center. And then we also cover all of the background check costs that are weighed in by the state. So if you have a home that has 4 adults, that would have been $48 a person. So those have been really awesome to see people to move through that process really quickly. And you're right, Melissa, I'm really excited about the health and safety grants and relieving some of those barriers. Somebody may not perceive their facility as doable or viable because they're lacking a second exit. State Fire Marshal says you have to have required 2 exits. through these funding opportunities, we've been able to have facilities change homes and actually put in a second exit so we can ensure everything is safe. So these have just been great funding opportunities for facilities to really find a way and entry points into becoming a provider in their community.
Thank you both. Anything else?
This is Delise, and I just want to first say amazing work, really good job. I lived in Hayes. I went to high school in Hayes and graduated from Fort Hays State, and I had an in-home daycare. That's what I did for my job. And so to see that we are putting some funds into helping home daycare people get started up is a huge advantage to those folks. It's not cheap, and there are a lot of rules about what you have to have and how things have to be done. So I think that's going to be a really great incentive for people. And I think that's an important piece for childcare across the state, not just, in the case that I was in. My question is this: how does this program connect with people from different counties to try to expand the word? So when I looked at the map, there were several counties that hadn't been touched yet, right? So is the goal that we would try to touch more counties from across the state? And if so, what are the mechanisms for doing that? And you also had my heart when you were talking about extension agents, because my dad was a county extension agent in both Logan and Hayes. So it was fun to see that connection there too. I had no idea that the extension agency would have anything to do with anything like this. That was a surprise connection for me. So I'm just curious about how the word kind of gets out.
Well, I'll offer a few thoughts if that's okay. Yes, there's absolutely a goal to connect communities to one another so that we can spread successes, spread lessons learned, and build energy to address childcare in the counties where we aren't yet engaged, or there isn't a coalition formally, working together yet. That is definitely on deck for the next couple of years, is to continue to expand our reach, connecting communities to one another and sharing ideas across these communities. I'll maybe offer just a quick preview. One of the strategies that we're hoping to have come to fruition even just in the next couple of months is actually bringing our PDG funded communities and action communities together in November to continue the learning process and share with one another in sort of a part 2 summit. So hopefully I didn't give away too many details, but we're in the process of planning that event. And it, again, with the idea that, all of these communities have had an opportunity to work to get, in their local groups, but this is an opportunity to continue to share with one another. Another strategy that I'll share that we have sort of on the back end, Child Care of Kansas offers a point in time data resource. It's available on our website, and Sarah mentioned that in discussing kind of how they explore their childcare landscape. That data tool pulls information about childcare supply and demand straight from our database, which is populated with information from childcare providers, and we update that regularly. It also allows us, when on the back end, to see when a community is retrieving data and information about childcare at the county level. And it's allowed us to be proactive and reach out and call and say, hey, I think there's some interest in childcare happening in your county. We're seeing lots of retrievals from this data tool. And is there an opportunity to work together and maybe, capitalize some of that energy and that interest that we're seeing just in terms of how the data is being pulled out? That's a strategy that we use at Child Care of Kansas, and it's helped us proactively reach out with right time or just in time supports and services to communities as they're building energy and exploring the childcare landscape. So we have a few different tricks up our sleeves, but definitely a lot of intention and focus coming to reaching the communities we haven't been engaged with yet in the coming years.
That's awesome. Thank you so much. That was very helpful.
Anything else? Well, again, Kelly and Sarah, we thank you. I think we're going to hear from Melissa some more later. But anyway, we appreciate the report. It is exciting work, and it is just so practical and needed. I really appreciate it. Thanks a lot.
Thank you.
Okay. Melissa, do you want to give us an update on the preschool development grant?
Yes, thank you, Kim. So I hope that what you get out of the presentation you just heard is the role that PDG has played as as a catalyst for systems level change. Without those funds, a lot of the planning behind initiatives like this probably wouldn't have gotten off the ground. And then we've been able to hand off the baton to other sources of funding that really make use of all the work that went in. The planning grant year of 2019, which was obviously pre-pandemic, was a time of assessing what Kansas had going on in the birth to 5 space for the early childhood system writ large. So not just childcare, not just preschool, but also some of the developmental screening programs, home visiting programs, parent education programs. It's that whole mixed delivery system that we talk about that the 4 partner agencies have been, that all play a role. So again, it's the work of the Children's Cabinet, the Department for Children and Families, the Department of Health and Environment, and the Department of Education teamed up on preschool development grant. So we had our 1-year planning grant. We did our comprehensive statewide needs assessment, which led to the development of the 5-year strategic plan for early childhood, which we used to apply for the 3-year PDG renewal grant that we currently are in year 3 of. And I am really excited that the Administration for Children and Families, which is part of the U.S. Department of Health and Human Services, has announced there is a new funding opportunity for preschool development grants, birth to 5. It is another 1-year planning grant, and we are a state that is eligible to apply. So there are several states in the country that have not yet received preschool development grant funding at all. So those states are eligible. And then renewal grant states, there are 23 of us, are eligible. It is not a huge amount of money. The awards they've announced will range from $500,000 as a minimum to $4 million maximum. And they are estimating that they will give 10 awards with priority for the states that have not yet received anything. So it will be highly competitive. I'm not sure that we will earn it, but I am really proud of the work that we will use as the launch pad for the grant application. It's a tight window to write the grant. It was announced in late September, and the deadline for application is coming soon. It's 1 month from today on November 7th. The grant follows the same structure. They ask that we do needs assessment work and tell them what we anticipate doing with this funding in that realm. Use that to update or work on our state strategic plan. The categories of maximizing parent and family engagement and support for the birth to 5 workforce are still involved, as is quality improvements. But they have placed a very heavy emphasis on the workforce shortage for childcare, and they are looking for innovative compensation strategies to be woven into the grant application. There is also a requirement that a certain percentage be spent on developing and implementing a program performance evaluation. I feel really good about the work we already do in that realm. So we have to show the connection to the renewal grant and how this application builds on the work already happening. So as competitive as the pool will be, I feel very confident that Kansas will submit a strong application. So the team is hard at work assessing how we use not a huge amount of money as a force of good to continue the momentum. And I would say from the prior rounds of preschool development grant, Kansas is the amount of our award has kind of fallen in the middle of the pack. So when you hear that range of 500,000 to 4 million, we based on population and other factors that are considerations, we've tended to land somewhere in the middle. So that is the update on PDG in terms of potential funding to keep all this good work going. I also want to update, we have had an ongoing update. I have talked at many meetings about the work that goes into that RFP for a workforce registry project. It is a technical project, an IT project, so we have had to work very closely with the Kansas Office of Information Technology, as well as through the Department of Administration, their Office of Procurement. And there is a very rigid process that is involved with getting a project like this out to a vendor under contract. So we were able to get approval for the content of our RFP back in March and get that posted. The application period closed June 8th. Our own review team completed the reviews of the applications we received by June 28th. We turned in the report to the Office of Procurement. We then had to wait while demonstration meetings were set up through the procurement office with each vendor that was in consideration. We had to have a very prescribed demonstration opportunity for each vendor to show their capabilities and be able to do a Q&A with the procurement team. And then once those were completed, which didn't happen until very late August, we then turned in the final recommendation as to the vendor of choice to the procurement team. And that is where it stands. We are waiting while the Office of Procurement handles the contract negotiations. So it is not something that we here at the Cabinet are personally involved in beyond having made this recommendation. We are anxiously awaiting. We are ready, raring to go. That project will build an online workforce registry for childcare providers to use. All of that work that goes into getting started, the licensing requirements, the professional development, coursework that is required, all of those hours of continuing education, that all can be managed through the registry. Right now, providers have to manage that in the realm of paper, which makes it hard to then submit that paper to the agency for validation to keep up with licensing requirements. So we are very much looking forward to entering the 21st century modern age, getting this online and in the world of electronic file sharing and just be able to make that process easier for everyone to manage. The registry will the intent is to dovetail the rollout of the workforce registry with our new career pathway for childcare providers. So we are trying to give some structure to that profession, to professionalize it, to show people that you have options. You can enter this profession straight out of high school. There is CTE certifications that students can get. They can then start a career as a childcare provider, entry level right out of high school with certain qualifications being met along the way. They can grow that career without ever going to college. There's also a pathway for people who do want to advance their formal education with a 2-year degree, a 4-year degree, and graduate studies. So we want our career pathway to show the value of choosing this profession and showing the way to a professional path with or without a college education. And so there are various certifications that can be met to advance. We want the career pathway to then also align with the work of the quality improvement system that DCF is the agency of record of implementing. It's called Links to Quality. Links to Quality was a response to a federal requirement of the Child Care Development Block Grant funding. So there were several years of pilot study for what the Kansas program should look like. And as we were transitioning from the pilot and synthesizing all of the information that was gleaned and learned from that experience, the pandemic set in. So that work has been a bit delayed for a variety of reasons in terms of statewide rollout. We have applauded and supported DCF as they have implemented some activities for quality improvement during the pandemic to help support child care providers with developing their business skills and helping a need that was laid bare when all of the various pandemic relief options began to roll out, and certain criteria was needed to apply for things like the PPP program. You needed certain business documents and information that some providers who were licensed to care for kids in their home maybe didn't have, because they weren't thinking about things along the lines that the Small Business Administration was requiring. So we've been helping grow that program, but we really envision a big rollout of these three initiatives in tandem with each other. So it's important for us to see the procurement process completed and the work begin on the workforce registry. We are excited to launch a website we've been talking about for a while under a different name. We are branding it All In for Kansas Kids. It can be found at allinforkansaskids.org. The Kansas is spelled out, not abbreviated in that web address. It is intended to be a website that makes it easier for families, providers, and communities to find what they need quickly, while strengthening the connections between the Kansas Early Childhood System partners, provide resources and information as a one-stop shop. Part of that navigation piece that we identified in the needs assessment work. The website offers Kansas families, providers, and communities a streamlined path to the early childhood resources, services, and information they need. It will serve as connective tissue between already established resources, things like 1-800-CHILDREN and Child Care Aware of Kansas and so forth. And it will also be a place that new initiatives, forthcoming elements of the Kansas Early Childhood System will be connected to. So things like the career pathway, you can access them here, as well as the likely home for that information is the DCF website, but we'll be connecting to it. The resource aims to boost the signal, so to speak, for our early childhood system partners, not to replace or disrupt any of the other work. So sometimes it's hard to know where, you have a question you need to find an answer to. You may not know that, oh, when it's a licensing question, I have to go to KDHE's website, or it's something else. So this website is supposed to just be a tool in the toolkit that presents information in one aggregated source. I want to point out that the community page will help local stakeholders strengthen their early childhood efforts and solve their early childhood challenges. The local site will help connect to grant opportunity and other types of funding opportunities, research and data that's relevant to their local community, and provide personalized support to solve challenges and help the community brainstorm solutions. The local communities will also be able to learn about innovative solutions that other communities have tried, and it will serve as a hub to help connect peer-to-peer communities so they can learn from each other. So when you talk about how we publicize to counties that maybe aren't already part of the community in action, this is one more way that we will communicate out. It's just kind of an all-in type of communications project to use every channel that we can to maximize knowledge about the resources available. The site will grow and change over time. It is a place where new initiatives will be promoted. We've got some things that are actively in development. We're excited to bring forward. I don't have specific timelines for these resources, but we will be adding a community data dashboard that provides community-specific data on topics ranging from poverty and employment rates to birth rate trends for each community across Kansas down to specific zip codes. There will be all kinds of data visuals that will help showcase that picture of who lives in your area and what the needs might be as you are a community trying to address questions about childcare capacity and the like. Again, meant to enhance and support, not replace any other tools in that arena. We will provide developmental health milestone information. There are certain screening tools that we use here at the cabinet, things like the ages and stages questionnaire, resources and information relevant to the Help Me Grow concept, which simply put means there is no wrong door to access the support that you need for your family. So it may be your pediatrician's office. It may be the family resource center in your community. It may be that you are at a workforce center applying for some training or looking for work, and you know, when they realize you have young children and there are other questions and needs, they help connect you. So that's the vision for Help Me Grow, that it is no wrong door. So we want to help communities know more about that. The career pathway certainly will be connected. There is a new provider licensing toolkit in development at KDHE, a resource that will help guide new childcare providers through the process of becoming licensed. We will include a connection to that information and any other types of upcoming grants or assistance programs, things that you know, you would be directed if it's a childcare aware administered program, we would link you there. So the vision for this is that this is a hub that connects to all the other wheels of activity going on in the state, and we hope that it is a useful resource for families and providers. There is lots of other PDG funded activity in play right now. We have the whole network of sub-grant recipients. Those are local grant funded projects through PDG. I mentioned the focus areas are family engagement, workforce development and support, and quality improvement. So the original sub-grant program was designed to help support the expansion of infant and toddler care for children with special health care needs, care for children and families living in rural communities, helping grow the provider network, the recruitment and retention efforts. So all of that work is underway. The third year of PDG technically ends April 29th of 2023. So we're coming up on 6 more months or so remaining. The first 2 years, they have provided some no-cost extensions to carry funding over a little longer. Judging from how they are handling 20 of the renewal grant states whose grants end at the end of December, they're giving a third year no cost carryover. So we are anticipating that the three of us that have the April cycle will probably also have that opportunity. So we expect to stretch it a bit longer as we work to complete projects, and are very hopeful that we will receive an additional 1 year to assess where we are and do some planning for the future for sustainability purposes. So I'll stop there and leave open the chance to ask questions before I bring Melissa in to give an additional update that is relevant to PDG.
Okay, any questions, comments? You must have covered it.
That's great.
All right.
Do you have, Kim, did you have? I thought you were going to say something else.
No.
I wanted the chance for Melissa Schoenberger to come and give an additional set of highlights related to work that is going on in a group called the Child Care Systems Improvement Team, which the acronym is the SIT team. That is organized under the umbrella of KDHE, and I will let Melissa come explain the reason the SIT team exists and the role. We have provided some facilitation help courtesy of PDG, and there are some nice highlights. So Melissa, I will turn it over to you.
All right, well, thank you. Before I begin though, I do want to share that I sit in on a lot of these systems meetings that Melissa just shared with you guys. And every single time I hear how all of these initiatives will be impacting in such a positive way our licensed providers, I literally get chills. And just thinking about the work, especially with the registry, it won't only just impact providers, it will impact the system and the day-to-day surveyor work. So excited, and the level of professionalism with the career pathway. So just had to give that big shout out to Melissa, because it's like hearing it fresh every time we engage, and it's just an exciting work, and I cannot wait to see it impact the larger the system, especially for providers. Well, I just would like to introduce myself. I'm Melissa Schoenberger with Child Care Licensing. I serve as the Assistant Director. I think I'm going on my 17th year with Child Care Licensing. So I like to think I've been around a little while and can bring something still fresh to the table, and love the evolution that we see Child Care Licensing moving in the state of Kansas. And I think part of that work is because of the systems improvement program. The systems improvement is a team of stakeholders across the state who really look at supporting the child care licensing program. Really had a resurgence back in 2020 with the ability with the PDG funding to really be the backbone of how do we get this on the table again, and how do we get moving forward? Because I'm a firm believer that your program should continuously be reviewed. Where are opportunities that we need to identify? What protocols can we look at that are perceived barriers in the way we handle our day-to-day operations, and what can we do to enhance the work of our backbone, which is our providers in the state of Kansas. So again, as I stated, the group is comprised of stakeholders from across the state and early childhood care and in the education system. What I am most proud of is when I look across our meeting group is that we represent all four corners of the state. That was something I personally live in Hayes. And when we had the systems improvement team, and it had a whole different name back in 2010, really the state stopped past Salina. And if you could not travel, you didn't get to participate. Well, Kansas is a much broader community, and each section brings something to the table. It's their story. So I really appreciate that we have folks from all the way from Goodland to the southeast corner in Chanute, all the way to the southwest. And then we are also very mindful of the time that we just don't meet during the day. We also really want to engage home providers. So we have an opportunity to make sure that we meet in the evenings, because we have to honor their time and their schedule if we want them to be a voice of our table. So in 2021, the group put together 14 recommendations. We're really excited that we were able to cohesively look at these recommendations and then really translate them into work. And I'm all about even a small win is a win. So we celebrate these wins and we really look at them. How do they impact our program, and how do we positively translate that and share that to our providers? So one of the small wins that we have is that we really wanted to provide some clarity to regulations. There are times when regulations, I've been at childcare licensing 17 years, and I might look at a regulation and it still confuses the heck out of me. So we really want to look at how do we make sure and translate that. And then not only that, translate that in maybe a policy exception that provides some relief to the workforce. And we did that in two ways with 2 policy exceptions. We worked with we listened to our stakeholders, and we worked on a way to craft with a workforce crisis to give our program directors in center-based facilities an opportunity to not just be bound to a regulation where it stated that they couldn't have any other work duties assigned. We knew during the pandemic with a workforce shortage that just wasn't doable. And so we needed to give some relief when staff were short that day. And then program directors did not feel the heats of, oh my gosh, this might be the day my surveyor shows up and I'm going to have a violation notice. We don't want anybody working under those circumstances. So we provided through the recommendation of the SIT team, a policy exception to support those providers. We are, as Melissa alluded to, we are working on public awareness through an ad campaign. Lindsay, can you move the slide forward, please? And then this immediately translated into what can we do through that campaign. So it's twofold. We are looking at a toolkit specifically to help home-based applicants. We have lots of great data through the systems improvement team to look at where do applicants get lost and why do they not maintain over that first year. So we really want to fill that gap through our toolkit to provide that support, not just have the surveyor be that support, but really looking at the whole system, where it's childcare aware, where it's our health consultant network, really being holistic about how we support that applicant through that whole process, because it is really a lift to keep them going that first year. And then I'm really excited with this ad campaign that we're going to have. It's really be focused on the importance of quality licensed care and demystifying what it really takes to be a licensed provider. We hear through the systems improvement team and our stakeholders all of this misconception of what you need to become a licensed home provider. We really want this ad campaign to kick off and be a warm welcoming to applicants so that they understand that they can do it. And not only can they do it, they have the support. I really am excited to hear our ad campaign was actually spent a week in Kansas last week, meeting with home providers, hearing their stories and their voices, and not just in one part of the state. They literally drove all through I-70 and started in Garden City and engaged all of our providers that we recommended to really make sure that this is fruitful for the state of Kansas. Also through the systems improvement team is our GO team, and you're going to hear more about that over the next few months. But it really began as just a seed, just a nugget in the systems improvement team of how do we work as state agencies to help when a community has defined a crisis, that we help them reframe what that crisis really means for their community, and how do these stakeholders come together to help them move through then maybe the next layers of the communities in action. So really excited to see that moving. Now it's fully funded and it is going through under the umbrella of the Child Care Aware program in the state of Kansas, but we will all still be a part of that. And licensing will still be a part of that and GO team. So I just wanted to give that little opportunity to share how just a conversation in our systems improvement team then elevates to a really functional program in the state of Kansas. Really, we took the summer off. We had our first meeting last month, and we are looking forward to seeing the challenges that the systems improvement stakeholders are going to put forth and what we can do to help support specifically the child care licensing program and our licensed providers. And I'm open for questions.
Okay, well, Melissa, is that the end of your section here on the grant? Well, let's just see if we have questions for either one of the Melissas. Anything? Well, appreciate the good report. There are so many pieces to this. I'm glad you guys keep track of them. They are, and you did a good job of not having too many acronyms in those reports. I appreciate that a lot. Like I said, it's practical work and good work. We appreciate the accomplishments.
I think before we move to the agency updates, I would just leave with the understanding that all of this work involves partnership, strong partnership and collaboration among the state agencies partners, particularly Department for Children and Families, teams up with KDHE when it comes to child care licensing. These activities often are, the underpinning is funding from the Child Care Development Block Grant funds they receive federally for child care subsidy and quality improvement and the licensing activities. So there are interagency partnerships, and that work also, it's a blend of funding from multiple sources that has made this happen. So some money from PDG to support the SIT team itself, some money from the CCDF fund transfer to support licensing activities, and pandemic relief funds that have been brought to bear. And when you hear about all the multiple different types of grants and funding opportunities that are going on right now, please know there is coordination and collaboration among the agencies to bring them forward, and that includes the outside resource and referral partner at Child Care Aware, which typically gets tapped to help with the administration through their state contract. We are not doing each of these programs in a silo, so there is knowledge of all of the many different sources of support that are being made available courtesy of the pandemic relief funds coming to the state, so that we can make sure to align and coordinate the activities. So I just wanted to make that plug, Kim, and now welcome a chance for the agencies to give their own updates.
Okay. Well, looks like we've got an order to the process as usual. That's good. Amanda Peterson, you want to kick this off?
I'd love to. Good morning, everybody. It's great to be with you all today. My name is Amanda Peterson. I'm the Director of Early Childhood at the Kansas State Department of Education. And I've got 3 things to share as we get started with the school year. One, to the point that Melissa shared about how much we appreciate collaboration as we're working in early childhood in Kansas. I know we've had many discussions with this group before about the importance of transitions into kindergarten. You all might recall that the recommendations panel brought to you a recommendation in this area, and that you all adopted the transitions toolkit that was created to help communities really partner effectively and make sure that children and families and schools are supported as children reach that really important milestone of starting the first day of kindergarten. So I really appreciate the partnership with the Kansas Head Start Collaboration Office at the Department for Children and Families and the Kansas Head Start Association as we support communities in this really important work. And I'm so glad that at the KSDE Great Ideas in Education Conference in Wichita, October 19th through 21st, those partners will actually be presenting on a session on this topic to be able to share some successes from communities and help spark ideas for other schools as they're working to to get started. So if any of you all know people who will be in Wichita, we're looking forward to seeing them there. And we're really looking forward to that session as we continue to help make sure that we can support communities and children in the transition into kindergarten. On that topic, we also have been digging into data with some partners. So we visited with the State Interagency Coordinating Council last month as we examined several years of statewide data for the Ages and Stages questionnaires, or the ASQ. This is data that you all look at as part of the common measures for children's cabinet grantees, and it's something where we were able to zoom out a little bit and take a look at the broader range of statewide data that we have available after several years of implementation of the statewide ASQ system that's been supported in part by the preschool development grant funding. We had some really terrific conversation with that group as we were looking at the aggregate results of children over time and seeing the areas where there might potentially be need for additional support. And we especially had some conversation about the area of fine motor skills, noting that that's something that we've seen more children over time have areas where they might need more support. And so we had some really terrific conversation about how we can get upstream, so to speak, and to think earlier in children's lives. We thought about, engaging occupational therapists and being able to really educate families of infants about the importance of tummy time. So it was a really great conversation, and I'm looking forward to continuing to do that in the future. And then finally, September 20th was a pretty important day when we're thinking about what we know about early education in Kansas, because September 20th is the day that we set for determining the official count of students who are enrolled in school. And so schools are finalizing that data. So we are really eagerly looking forward to getting that preliminary report of where preschool and kindergarten enrollment is for our public schools in Kansas. That's something that's fluctuated quite a bit in recent years due to the pandemic. And so I'm looking forward to when we meet next, when we'll have some of those preliminary numbers for this year to get a better sense of where we're at. So I'm glad to answer any questions, but if we don't have any, I'll turn it over to Amy for a children's cabinet update.
Okay, well, let's just give a space here. Any questions for Amanda? All right, well, thanks a lot. And our own Amy Meek. Amy?
Good morning, Amy Meek with the Kansas Children's Cabinet Trust Fund. I'm the Early Childhood Director. And the last several weeks, I've been able to get on the road and go visit our early childhood block grantees. It's been a couple years since I've been able to meet with them in person, but those have been really rich meetings. I meet Dr. Lynn Strufferman, who's from Wichita State University, and our lead evaluator for the block grant. I meet her at the site visits, and following her presentation to this group in August, her team gets busy kind of breaking down that data report to individual reports for each grantee. So we're able to talk through that and walk through that and answer any questions. And it's so valuable for those grantees to be able to see their own data and pulled out, and we're able to troubleshoot any challenges, whether it's in the data collection itself or with just thinking through the outcomes and how they can make some improvements and for this coming year. And then also celebrating successes. And that's really important too, because it's been a challenging couple of years for our grantees. So those visits have gone really well. We just have 3 left, and completing those in about a week. And then we are working on our early childhood block grantee or grant RFP, still drafting that, as we talked about at our last meeting. And our intent is to have that out at the beginning of November. And so we'll make sure that we're shooting out lots of communication and letting people know that when that's coming, and all of the timeline for that. And lastly, at our last meeting, we talked through the community-based child abuse prevention grant, and we were waiting on our award. We did receive our award in the last week of September, right before the new grant period started October 1st. So we the grant award allows us to follow through with the plan that you all approved for the slate of grantees. And so we are working to get all of that paperwork and all of the grant awards put in place so the grantees can continue the work. It's always a little bit stressful. I think a lot of them have gotten used to the last minute, know that the award comes pretty late in the grant year or the beginning of the next grant year. So we're pleased that came and we can all move forward and we've already started now a weekend to the new grant period. So that's all I have.
All right, let me just check to see if there's any questions for Amy. I don't see any.
Can we
Yes.
let Amanda answer a question about the conference that she mentioned?
Sure.
Absolutely.
Sorry if I cut somebody off. I didn't see that.
No, it was just me, Kim. I was slow taking myself off of mute. Amanda, I dropped the question in the chat, but if you could just provide the information, the details for the conference that you referenced in Wichita, or the website where I can look it up. Apologies if you provided that.
I haven't actually, so thanks for asking, Terry, because the deadline to register is actually on Monday, October 10th. So that's really timely, and I probably should have mentioned it. There's two easy ways to find the registration link. One is to visit www.ksde.org. There's a big banner on the front page that scrolls through main announcements, and currently it's the third one on that banner. The other piece, if like me, you're on Twitter and that's where you keep track of most of your stuff, you can visit the KSDE Twitter page, which is at KSDEHQ, and they tweeted out the registration link. It looks like on October 5th was the last time that they did. So those are both easy ways to get information. It focuses on the art of teaching, and we're really looking forward to the event.
Perfect. Thank you. I'll try to drop in. Thanks.
Was something else? I thought I heard somebody. Okay.
Kim, we have a new designee joining us from the Kansas Department of Health and Environment.
All right. Drew, if you want to introduce yourself a little bit as you start your remarks, that'd be great. Welcome.
Yeah. Thank you. Good morning, Drew Duncan, Kansas Department of Health and Environment. I am the Interim Bureau Director for Family Health. Happy to be here and share a few updates. Just in week 4 or 5, so a lot of new information to take in, but a lot of great work going on as well. So as you know, going through the regulations amendments, the current 28.4.114 is open for public comment until October 28th. And more information about that can be found on the KDHE website. The major change from that is the ratio, the infant to provider ratio, going from 1 to 3 to 1 to 4. And there have been a few changes to the tables that are included in that regulations as well. Melissa has added an additional informational webinar for providers, and that'll be on October 24th. And then there will be the public comment hearing on the 28th. And it was requested that if you would like to provide comment in person, to bring a written copy of your testimony. And then we will have the JCAR testimony on the 18th at 1:45 p.m. And then on October 3rd, we went live with the digital fingerprint waiver and the live scan locations. And at the same time, letters went out to providers and partners. I'm really excited about that. We hope that it does reduce some barriers to completing the waiver, as well as create some efficiencies within the processing time for the fingerprinting. I believe the digital fingerprinting option is now available at about 50 locations, majority of those being law enforcement entities. And then just a quick update on the child care bonus program, which is a lot going on with that, but a really great thing. Fiscal has moved from direct deposit, where they were seeing some issues with some of those direct deposits payments coming back, to payments by check. The application process is going really well. We have hired some additional support staff for our fiscal team. That is kind of where the bottleneck is at this point with the number of applications that have been processed. It's a time-consuming process to get them into the payment system to actually submit the payment. So that's where we're kind of delayed right now, but working through some things. So to date, we received 8,913 apps, 7,248 have been processed, which represents about 17.4 1.4 million. And then the number of applications that we've had processed by fiscal right now is 1,161. So you can see we're a little bit delayed there, but we have hired some additional support staff to help them kind of speed up that process. Those 1,161 account for a little over $3 million of funds that have gone out to this point. And then just as a note, any childcare providers should be directed to Childcare Aware for additional details around that program. And then lastly, I may have been given in the last meeting, but we've added a new childcare license section director, Jarvis Dolman, who is on the meeting, I think, today. So we're really excited to have him on. He's just in week 3, I believe, so he's really new. But we're excited about the stability that he's going to bring to childcare licensing from a leadership standpoint. Has already really begun to dig in and work with the team. And so we're looking forward to that and him growing in his role. We've also brought in a systems management analyst through our temp service, Insight Global, where she'll be looking at our processes, procedures, and positions, and then making recommendations on how the team can be more efficient and effective. And so that's also something that Jarvis and I are doing as well, is looking through our hiring needs and prioritizing those so that we can be sure to bring this support on in the most effective way. But a lot going on, but that's what I have.
All right.
Kim, I have a question for Drew, if that's all right.
Sure.
It's John Wilson with Kansas Action for Children. Drew, welcome to the role.
Hi, John. I'll do my best to answer your question. I'm gonna.
Yeah, so it's a very specific question, and it has to do with the requirement to have printed remarks for the testimony for the public hearing. I'm used to the legislature where we need like 40 copies for the committee. Is it just one copy? And if it's not just one copy, I would just say that KAC is happy to print things for folks who, if that's a burden for them.
For the public comment here, it's just one copy, and I think that's for our records.
Okay.
To keep track of those. Yep.
Great, thanks.
That was simple enough. Thank you. I was a little worried because Melissa, she's on vacation. She was kind enough to jump on this morning for part of it. I know she's off, so I got a little bit nervous there, but I can handle that.
You have friends here, Drew. I promised you a friendly crowd. So
yes,
we appreciate you joining us. Kim, I just want to underscore the magnitude of a couple things in Drew's update. The process of updating state regulations is a very involved task. Let's just put it that way. And we are in the late stages. We have had multiple eyes on the regulations themselves. You have to collect stamps of approval, literal stamps of approval on those things from each agency that's involved, each entity along the way. This public comment period is very important to allow the public to weigh in. It's been open for a number of weeks already. We want to just help publicize and lift it up. We are hopeful and looking forward to a positive outcome for these changes. It addresses long-standing issues with the ratios in childcare and some, anomalies that differ between the home-based setting and the center-based setting with regard to infant care. So we hope this will help improve access to infant and toddler spaces in childcare programs. So we're happy to help publicize that. And then the electronic fingerprinting process, huge lift to deal with another process that is a mandate for the fingerprint background check is at least in part a federal requirement, and also I think some state level requirements as well. And it just was getting bottlenecked because we were paper-based. Once again, by not being electronic, it added major time to the process as things got mailed from one site to another. So we enjoyed support from Ed Klump and his association. They did a survey of law enforcement locations around the state, and we did a pilot program that DCF and KDHE teamed up to share some existing electronic live scan machines that DCF owns and has deployed at their regional offices. And that was so successful, we added the law enforcement sites as additional capacity for places that will allow non-criminal background checks to be done. That was the key. Which law enforcement locations could you walk in as a childcare provider and say, hey, can I do my fingerprints here? It involves some, on the back end, there have to be agreements in place between the entities involved. So it's been in the works for the, most of this past year. We've been working our way through the pilot and all the hoops that had to be gone through, but it is now statewide, and it even involves the ability to request a mobile unit come to your childcare center if you've got multiple employees and want to schedule an afternoon where they just all give their fingerprints at once. And as we hit a 5-year anniversary where a good majority of childcare providers are going to need to renew, this is a really nice feature to have. So I just want to applaud the agencies involved for the work that went into the rollout of that new, more modern fingerprint process. So thank you, Drew.
Yeah. Thank
Thank
you.
you, Melissa. Yeah.
It's always good when we see government working to
Exactly.
ease the burden on its citizens and achieve the public good. So we thank you all for those efforts. Tanya.
Good morning, everybody. I'm Tanya Keys with Department for Children and Families in the role of Deputy Secretary. 3 updates today. One is we have 2 requests for proposals that are currently under review that we would hope to award and announce by December. We have one for the Family First prevention grants. Some of those grants include parent skill building evidence-based programs, so would involve home visiting and some other pieces. So we're excited for our second round to get those awarded. In addition, we also will be wrapping up a request for proposals for family resource centers. And so we had a number of applicants for that. We're excited about that. We're also excited about, since family resource centers, in the sense that they would be certified through that national model, we don't have common measures yet, but we are excited and included in our request for proposal that we hope in year 1 of the award of these family resource centers to use a group or use some folks who will help us and think about those common measures and maybe overlap some of the pieces that you all have really led very well in terms of what are appropriate early childhood measures. So we look forward to getting started in a more formal way with that through those awards. The final update is in August, DCF wrapped up 8 community meetings that were with stakeholders that were required through proviso for us to do about performance-based contracts. And those performance-based contracts, I think a lot of folks think about foster care, but the actual, the language in the proviso said that we needed to do foster care prevention and early intervention. So we invited a lot of different folks across those 8 cities, and it was really great to hear. Most folks really wanted to talk about prevention and early childhood and all those opportunities in their communities and what does performance-based look like for prevention in early childhood. So we enjoyed those. With regard to that requirement, we will be writing a report and a recommendations for implementation plans on how DCF would have the best construction of what does a performance-based contract or grant look like. That report isn't due until January when the legislators come back to town, but we'll have that report by January. Those are my updates.
All right. Well, that performance-based thing, obviously, that's important. I mean, it affects the overall structure of everything, I would guess, Tanya. Is that right? Could.
Yeah, well, we hope so. We all want better outcomes, and we need to be able to know how are we doing with Kansas families. So, yeah.
All right, thanks a lot. I understand Carla's not here. Do we have somebody else from the Board of Regents or not?
Carla emailed me a brief summary. to share. She says that in June 2020, the Regents adopted a new strategic plan for the Kansas higher education system titled Building a Future. The plan focuses on how colleges and universities can best serve Kansas families and businesses and advance the state's economic prosperity. The goals that are included in the Building a Future plan involve improving access, reflected in the college going rate. So they will explore a model with their K-12 partners that scales early college programs. Forgive me, I'm so used to early childhood. Early college programs. They are focused on affordability and on-time graduation. So they are working to identify system-wide math, general education courses, and meta majors for the purpose of math pathways, and define the system-wide general education math course that is required for each respective system-wide meta math major. And they are working to develop a statewide transfer associate degree in pre-education, which we're really excited to see happening. The system will identify at least 60 credit hours using the system-wide general education pre-major and early major courses that A, complete the requirements for the transfer associate degree at a community college, and B, transfer and apply towards satisfying baccalaureate degree course requirements at the 6 state universities without a loss of credit. That is a huge development that we should all be applauding. So I'm happy to see that. And then they are focusing on success in terms of degree and certificate earned. Each state university will implement the National Institute for Student Success recommendations to standardize academic advising services, training, and technology resources. And finally, they're focused on the talent pipeline, graduates in high demand, sustaining wage fields. So they are planning to work with industry partners to develop initiatives addressing teacher and healthcare workforce shortages in particular. I would cheerlead that early childhood should be part of that conversation as well as a critical need. So we will continue working, collaborating with our partners at the Board of Regents.
Okay, thank you.
Please don't ask me about that math program because I have no idea.
Meta math, yes. I thought it had something to do with Facebook, so I assumed I didn't have questions. All right, Justice Wall, we're glad you're here today. We've missed you the last time or two, but have appreciated you getting somebody here with us. Did a good job in your absence, but we're glad to have you today.
Yeah, well, you may wish for them to come back after today again, but
no.
No, it's unfortunate that I think the last 2 meetings have lined up with our court's docket. So, but I'm so glad to be back, and it's always exciting to hear about all the incredible programs. Just a few updates from the judicial branch, mostly focusing on training opportunities. The first, just so folks are aware that we are in the midst of our nuts and bolts training for child in need of care judges. It's a 6-part series covering really all the topics our judges throughout the Kansas court system need to know in order to successfully manage those dockets, both the legal requirements, but also the types of findings that those judges need to make to ensure that federal funding remains in place. And it's been well attended. We've had over 60 judges that have participated in each of those weekly training sessions. Second, the Office of Judicial Administration is going to host a series of juvenile justice trainings that will start on November 30th. And registration is now open for that November 30th session. That particular session is going to focus on the Center for Disease Control, Kaiser Adverse Child Experiences Study, and really focus on the reasons why children who suffer impacts of toxic stress are at a higher risk of just becoming involved in our juvenile justice system. And then finally, I've always given updates on this over the last couple of years, but the annual best practices in child welfare law training. We've got the date set for that for 2023. The first session will be on April 11th and the second on August 22nd. And I know that there are a lot of stakeholders active on the Children's Cabinet that have been a part of that. And so we're just asking folks to save the date in 2023 for those sessions. And that's our update.
All right. Well, appreciate your updates there and glad you could be with us today.
It's great to be here.
Any questions? I guess the justice accepts questions. I don't know. As a lawyer, I'm always nervous, presuming about a judge. So, anyway.
Of course.
All right. Any questions? All right. Hope Cooper, and Hope, I understand this might be your last visit with us in your current position. Is that right?
That is correct. I apologize for my video not working. This is my last day with the Department of Corrections. So as I was logging in, I realized I have disabled all the cameras and the speakers in preparation. I wasn't thinking through that very well. So I apologize for no camera. And that really is my announcement that this is my last day with the Department of Corrections. I am I'm working for a consulting firm called the Moss Group. So I'll be doing some criminal justice consulting on the national level. But I just wanted to take a minute and just recognize everybody on this cabinet. The work done through this cabinet is absolutely phenomenal. And I know that sitting on the cabinet as ex officio, I definitely probably am on the more quiet side, but have always been extremely impressed by the work that you all are doing. And just know that as a department, I've shared this with the secretary, he agrees. We are fully on board to remain a strong partner for you all in whatever way we can, because the work here is absolutely phenomenal. So I will miss these meetings. It absolutely was a joy to hear all the successes in a world where we don't always hear that. So unfortunately, I don't have any real updates. That's my big update for the day.
Well, I don't like to have this opportunity, but it does give me the opportunity to say that just many times when you've reported, I've thought how lucky we are to have somebody with the progressive, positive attitudes that you've brought to this work. And I'll never forget the day you talked about data sharing, and I thought Melissa was going to kind of fall off her chair, maybe. Because that is such, I think your participation has been much more meaningful than maybe you're giving yourself credit for. And I hope that your role as an advocate for prevention and child development inside the agency is going to be assumed by somebody because you've mattered, Hope, and we appreciate your work.
Well, thank you very much. I will tell you that it might take a bit. Given it's an election year, I'm not sure how quickly my position will get filled. So please bear with the department as we may have sporadic attendance here. I do have the secretary's commitment on the data trust meetings. Somebody will be there for certain each time, but we'll make sure and get you guys the updates. I will connect Melissa with our JGOC coordinator. So if there's grants going on with JGOC, that you all at least have the information if someone's not present to share that.
Hope, go ahead, Kim.
Well, I was just going to wish her well. I don't quite know what you're moving into from your description, but I wish you well, and I know you'll do a good job for the public in that role. Go ahead, Melissa.
Hope, I wanted to echo Kim's thanks for your contributions to the cabinet, and the vision to bring Department of Corrections into the data trust with us. And I will offer a little bit of an update because I stopped by the Kansas Children's Discovery Center last Friday morning, started my day with the grand opening of their new Storyland exhibit, which is a traveling exhibit that is interactive for kids that brings their favorite stories to life, which is amazing and well worth stopping in. But in talking to their director, Danae let me know that this week on Monday, they were hosting a special opportunity for I believe it's moms who are incarcerated to spend a couple hours. They have you guys have a program where they earn through the work they do and you know, the actions they exhibit. I believe they earn some release time to be supervised with their kids. And what Danae flagged for me was this would be the first time in really since the pandemic set in that these moms and their very young children would be physically able to spend time together, to hug each other. And I just want to thank the department for the work that you all do to help people incarcerated in the system rehabilitate and work their way to better outcomes in their lives, and the foresight to think about the needs of the children of incarcerated individuals. That was very moving to me to hear about that program.
Yeah, that's through our women's facility, and they have an amazing mom and child. We call it the WALK, Women's Activity and Learning Center, which again, the pandemic certainly has kind of hindered some of that, but I'm glad to hear that they're up and moving that as well. I do have, that story does bring to mind another situation that maybe if I'm able to share with you all. Out at KJCC, we did have a young female who came in pregnant, and we did the first ever baby shower that was supported through there. So we hosted a baby shower, and we also did an early release with her to her mom. So when she gave birth, she was able to release with the baby to mom. And so again, that idea of keeping those connections, so important, not to create more trauma. Our system already is flush with it. So just thought I would add that one in there as well.
Thank you so much for sharing that.
Yeah. Well, again, good luck, Hope. We've appreciated you a lot. All right, Melissa, do you have any further updates for us? I guess I need to be sure that I haven't missed somebody who I noticed Jarvis Dolman was been on. I didn't know if he was here to just kind of get the lay of the land, or if he had something he wanted to say. So I'll just give you that chance, Jarvis.
Thank you, Kim. I'm just excited to be here. Like Drew stated earlier, I'm in my third week. I'm brand new to the agency and everything childcare, but I do have a passion for kids. I work with youth outside of work at a nonprofit, Omni Circle Group of Topeka, Kansas, and so I'm just excited to be here to help further everything, all these amazing things that are going on. It's just gives me chills hearing everybody talk about what's going on in this state, and a lot of people that don't know what's going on. So it's exciting to know and to be a part of this and to be able to advocate and keep things rolling.
Well, welcome. We'll look forward to your participation. Thanks a lot. All right. Anybody else I've missed? If not, Melissa, what final updates do you have for us?
A few things, but important things. So at the June meeting, the Children's Cabinet adopted, the June 24th meeting, we adopted a recommendation to work on an evaluation of the evidence-based and promising practice home visiting models that are operating in Kansas, and develop recommendations to support a statewide approach to the home visiting infrastructure, and work on sustainability of those services for families across the state. The purpose of the recommendation was really to help us better understand the alignment of the 9 home visiting models that operate in Kansas, the deeper understanding of the options for increasing funding for different models will help strengthen the case for increased ongoing investment in home visiting services to meet the unique needs of all Kansas families. The good news is that Kansas is not starting from scratch with this process. As part of the maternal, infant, and early childhood home visiting program, which the acronym is known as MCV, KDHE engaged the KU Center for Public Partnerships and Research to conduct an update to the 2020 risk assessment that was done. They are really updating the data across the state from the counties, because the data used in 2020 came from data gathered during assessments between 2012 and 2017. So we are hoping that refreshed data will update our understanding. It will provide it will tell us that where risks are, communities where risks are high and a high percentage of children are being born with multiple risk factors. We're gathering the number of families and children served from all home visiting programs at the local level. Some is county, some is school district. So we're trying to map out where families receive services and where we have gaps in the coverage area. CPPR is also compiling community strengths, needs, and readiness for home visiting expansion, which includes the perspectives of home visiting programs and other agencies who serve expecting parents and families with young children. So I think it'll be a good comprehensive look. That needs assessment work will, I think it's on a timeline to be delivered sometime in December. So this work will carry into next year. We're not going to have any quick recommendations to bring you, but I wanted you to make sure you knew that we had activated this process. We also did some rapid data collection over the last couple of weeks to get a preliminary sense of where just overall numbers of kids and the variety of funding sources that programs use to knit together the funding they need to operate. And that's been the eye opener for me, even though I came to the work with an understanding that people had to apply for multiple funding streams to make it all work. Seeing just how many different things, how many different programs they have to apply to put their operational funding together is a major eye-opener. So we will continue that work. I'll bring you reports on that as appropriate, and hope for a set of recommendations in 2023 that we can begin to explore next steps, how we would activate on those. And then I think the most fun I've been having is with the Dolly Parton Imagination Library project. So as you know, we were designated by the legislature in 2021 to use grant funding. We used PDG to get started. It had a lot of guidelines and strings attached, so we weren't truly a statewide partner. But as of July 1, the Children's Initiative Fund budget is now funding the statewide expansion of this program. And as a reminder, we as the lead agency for the state use our CIF funding now to pick up 50% of the costs for children in Kansas, and then local affiliated programs pick up the other 50% share. This coverage map shows you where the program is actively operating. The counties that are listed in white don't have a program yet. So this is our mission to not only pick up make sure kids growing up in the counties that are completely without a program, as well as, and we have 12 of those, but also we have partial coverage in certain counties. So this is a map that is showing you the zip codes that have coverage. We are working with the network of existing partners to see if some of them have the capacity to expand and help fill in some of the gaps that exist in little pockets around the state. And we are actively seeking additional partners around the state that can come in where there's no existing program. Our most recent expansion was in Johnson County, which was one of the counties that had no coverage. And the Shawnee Mission School District Education Foundation joined us as a local affiliate. The partnership was announced at their annual breakfast in September, and in the first 24 hours, they had 1,600 children signed up, and by that was Thursday into Friday, and then by Monday, I think the numbers had grown to 2,400 children. So the demand was high, the need was great, and we are delighted with the energy going on. I am also in active conversations with foundations connected to Olathe and Blue Valley school districts, and beginning to put out inquiries with other areas in the state. So if you're listening and you know of a 501c3 nonprofit foundation that might be willing to help cost share with us, all you need to do is send me an email with the contact information, and I would be happy to pay a call and explain more about the program. Quick reminder, it is a very cost-effective program because Dolly herself, through her foundation, covers all of the overhead for the program and the cost of processing book orders every month. What our funding pays for the wholesale costs of printing the books for Kansas kids and the postage involved. All of the other admin is picked up through the Dollywood Foundation. It costs, it's $2.10 per month per child. So it's $25.60 a year. We split that in half. Really cost effective to give children the gift of reading. Eligible children, the only criteria is age related because they want to be sure they get books that are age appropriate in the hands of our children. So you can sign up anytime your child is within the eligible age range. That range is from the day they're born until they celebrate their 5th birthday. And so for those 5 years, that is 60 months. That is the potential of 60 books mailed free to the household, simply to encourage reading together as a family and helping children develop a love of books. Infants get board books, and there are age bands with age appropriate. Twice a year, Dollywood sends Spanish and English books out to pick up a bilingual population and help promote reading that way. And it's just a fantastic program. Dolly feels very strongly there should be no income limitations. She grew up in an incredibly poor household, and she said she does not want her program to create stigma, that it is some form of handout or only for the poor kids. So nobody is allowed to screen for income eligibility or any criteria other than the age of the child. She wants it universally available. So everyone is given the gift of reading. And we are excited to be working on this expansion with our Dolly Parton Imagination Library Children's Cabinet Advisory Committee. We had our first meeting September 21st. Deanne Graham is the cabinet representative on that committee, and we got to know each other. We did a briefing on the program and are working on some recommendations to bring back on next steps in the sustainability conversation to create our own nonprofit vehicles for this program, deal with ideas for promoting and expanding the library. So we are working to schedule our October meeting, and I'll bring you more updates in December. For affiliated partners, we are doing an informational webinar on Wednesday, November 2nd. There's more information that will be pushed out through the links, the listserv to the affiliates, but we want to just keep working to partner and be a good a state level partner to all the local programs. Dollywood informs us that we are number 7 in terms of nationally in terms of enrollment of children. Kansas is one of 15 state programs, and they are working to expand nationwide. So we are a high performing partner, which we should all be proud of. We have 103 specific local programs across the state, and as I mentioned, all but 12 counties have coverage. Currently, we are serving over 47,000 Kansas children in the age range. That is 24% of all children in the state who would be eligible, and reflects a 2% increase in enrollment just since July 1, when we were able to roll out as the true local or true statewide affiliate partner to the locals. So it's reason to be really proud, and I hope you can sense the energy that I gain from this. It's one of the happiest programs we run. You can see the areas where we have work to do. So again, I invite the reason for the emphasis today is I really am looking for foundations that would be willing to partner with us and bring books to every zip code in the state. Kim, I think in terms of business, the only remaining piece actually, well, let me pause before I get to our last question. I want to pause and offer time for questions or discussion.
All right.
Yeah, it's John from KAC. I just want to say that our family was a Dolly Parton Imagination Library family, and we loved it. And I'm sad that my kids have aged out, because both the books we receive and they're getting older, and that makes me sad. But I would just say it's a wonderful program.
Yeah, Lietta here. Melissa, I just want to thank you again for being the passion behind the Dolly Parton Imagination Library. I mean, what a tangible difference it will make in the lives of these kids and families. And it's not just literacy, it's togetherness and meeting the need of the kid where they are. We are so excited in Johnson County, especially having Nancy Wallerstein kind of represent us on that committee. So we're thrilled. And being on the Olathe Public Schools Board of Education, I guarantee you there will be big time pressure for us to, we're going to follow in Shawnee Mission's footsteps. I just am really sad that we hadn't led the way. It's expensive time in the world, so it's kind of hard to sell when pennies are tight, but we will get some funding somehow and make this happen. So thank you.
Thank you, Lietta. I would say we have partners who are library foundations, the United Way partners. There are private community foundations, private family foundations. We've got, I'm learning more and more from the Dollywood folks. The Rotary clubs are also a partner in other areas. So I want to make that connection here for Kansas. The electric co-ops, rural electric co-ops can be partners. They are in other states. So you know, there's a variety. You don't have to be a children's organization per se. Maybe there's a hospital foundation or a health foundation out there that might be thinking about ways to improve some of the social determinants of health. So just making that pitch for new partners so that we can make sure we get the expansion complete. And final reminder, this is purely voluntary on the parents' part, whether or not they choose to sign their own children up. It's not that the school district foundation has come on board and automatically everyone is going to have to. It's not like that at all. This is parent choice for their own children, but what a beautiful program.
Melissa, it's Delise. Quick question. Have you reached out to, for example, in Johnson County, the Blue Valley Educational Foundation? Have you reached out to them? Okay.
Yes, I had a meeting.
They would be interested.
Yep. Jan Kessinger joined he was elected to the Blue Valley Board of Education and immediately connected me to their brand new foundation director. The thing is, I met with her. It was Susan Tiedemann has joined as their new director, and it was her second day on the job. So we had a great meeting. She's got lots of enthusiasm. I know Tanya Merrigan, the superintendent, is also aware of the program and very supportive. So my hope is that as Susan gets her feet on the ground, she said, I have no filters. I have no idea yet what the board priorities are for the foundation or anything. So we are working together with those districts. It's my understanding there may be interest from DeSoto as well. I need to make that connection with their foundation. There are other avenues that I'm working as fast as I can to develop the leads. So any help with the right point of contact and contact information is what I'm inviting, because I will talk to anybody about this, but I need to know who to go see.
Okay. Anything else? Well, let's talk about meeting dates, I think.
Yeah, that's the final piece of business. Lindsay, do you have a slide for that? Yep, of course we do. So Kim, I would say our next meeting, the final meeting of the year, we are pretty close to on time in this one. It's been really rich discussion, but December will be the cabinet receiving the annual report and having the opportunity to not just hear hear that report, but you will get it ahead of time so that you can be familiar with it, bring questions, and it will include, as always, a summation of cabinet recommendations that we have developed over the course of the year. It's one final chance for any other. You can bring new recommendation ideas for the board to entertain. So that meeting will be an important meeting to plan for. I don't yet know what, if any, other regular business might be on the agenda at this point, but that's the biggie, the big featured part of that meeting. Once you have weighed in on that report, we will finalize it, and we will have a certain number of printed copies. This is the report we are obligated in statute to convey to the governor. So it's an important meeting. We have toyed with whether or not to be virtual or in person. This is a meeting, we have a location on hold. We could meet together in person here in Topeka at the Kansas Association of School Boards that morning. But what we want, we would be best served if all of us are either together or all of us are virtual. I think the hybrid meeting approach may be difficult in terms of the quality of the meeting discussion. So my question is what the will of the board is, whether you are willing to make the commitment to come to Topeka, or if you're just as happy with the virtual meeting format. I would open that up to your decision.
Okay, well, let's get some opinion on that. I'd rather hear from you before I say where I am.
This is John from Kansas Action for Children. I feel like I have the easiest to drive, so I'm certainly available to meet in person, but we really like to see folks who would have to make a longer drive weigh in.
This is Deanne. I'm based in Wichita, of course. And so I would say I'd love to come to the meetings in person if possible. I do travel a lot. So having the virtual option is nice to have if we can do some type of a hybrid approach with those being able to attend in person and also having a Zoom option.
This is Terry in Wichita, and I like the virtual meetings. However, I'm willing to come to the in-person in December as well.
This is
Hybrids
Leetta.
are tough
I'm
though.
going. Whoops, I talked over you, Terry.
No,
Say that
no,
again.
I was just gonna say, I have to echo Melissa, hybrid meetings are pretty tough as far as with the technology piece, those in person and connecting with those not, but anyway, there you go. It's all yours.
It's Leetta. I'm flexible. I'm in Topeka a lot. Happy to come and be there. It might add a nice little synergy of actually seeing each other, you know, and it is, I'd say, one of the most important meetings of the year. So it might be a good one to give it a whirl.
This is Delise, and I joined when we started virtual. So I've only ever known the virtual world. So obviously it's working okay for me. The thing that I think is easiest for me just specifically is managing work with managing the meetings. And it's much easier for me to not have to make the additional hours worth of drives to be able to do that. So virtual has been something. Having said that, I wouldn't mind seeing you all in person since I've never done that. So
I wonder, what I'm hearing is you guys would be good sports, but there may be some difficulties. So I think, Kim, let's make this a virtual meeting, but that maybe what we need to do is schedule a board retreat so that we do have an opportunity at some point when we are not doing formal official business, but we can do a get together that would allow us to meet and interact in person, get to know talk more about vision and priorities and less about order of business. So we could work on that. When Kim and I started in 2019, we did a retreat and we haven't really done such a thing since then. So how does that sound to folks?
I like that idea.
Okay.
It sounds fun to me. For one thing, I think, if we're going to use Zoom meetings, to me, it makes sense to do it in December and February when the weather can be an unexpected problem, especially not as likely in December, but certainly in that February meeting, I don't know what your chance is, but there's a significant chance of weather problems at the last.
Kim,
I would just say as chair that hybrid meetings don't excite me. Zoom meetings are fine. Face-to-face meetings are fine, but the mix is really difficult to manage just in terms of being sure that the people who aren't present really can be full participants. I mean, if you don't feel that way, that's fine, but that's just my experience.
I think that's our concern. We have the technical capability to put on a hybrid meeting, but we know the quality will suffer. So I feel good about this decision. We will release the meeting space and plan for a virtual meeting in December. And to the public watching, we will always use Zoom. Zoom was first brought to bear with the very first meeting Kim chaired, and it was my first meeting as executive director. It was our 5th day in our roles. The meeting was on the books. We said, let's just forge ahead and hold it. And then the state it was a blizzard that shut things down. So we quickly put a Zoom link together, thanks to the backbone support team. And we've been broadcasting our meetings ever since, but I think this is a good approach. Final question before we let you all go. The meeting schedule for 2023 is posted on the right of the screen. The question is April April 7th it lands on Good Friday, and we've danced this dance in the past where we've said, oh, we better reschedule that. And the disruption in the meeting flow has been difficult for some of your work schedules because we have staked out this first Friday morning of the alternate months for several years now. So I want to ask, because we want to be respectful, and we know sometimes that's a weekend for travel and that sort of thing. This is the question: is what your preference is. Would you like it to be the April meeting to be April 14th, or are you all able to commit to April 7th without feeling that your personal priorities and commitments are infringed by that choice?
This is Deanne. As a school-age mom with children out of school on the 7th, I would prefer the 14th.
Yeah, I would prefer the 14th as well. And also
Okay.
I think I have a board meeting that day too for my organization.
That was my first
In here.
thought, is that we ought to reschedule, but I know there were a couple board meetings one year that some of you had, or former members. I can't remember the roster at the time, but we have plenty of advance notice. So we will make April 14th the meeting date. It will be 9 a.m. that morning. So we still keep this rhythm going. And we'll just plan, we'll stop asking if you want to meet in person or virtual. We're just going to forge ahead with virtual meetings, and we'll see about putting a plan together for some form of retreat in 2023 at some point, so we can get together in person.
Sounds good. Any other comments or questions about that?
We'll follow up with an email that gives you those meeting dates, that gives the link to the conference that Amanda mentioned, and make sure that the cabinet group has all of that information as follow-up. And then you always can find those things on our website as part of what we post around the activities of the cabinet. So thank you.
Thank you. Is there a motion to adjourn?
So moved. This is John Wilson.
Second,
Yeah, and I'll second.
Been moved and multiply seconded. All in favor, say aye.
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 Opposed? We are adjourned. Thank you, everybody, for a good meeting.
Have a good weekend.
Hi, everyone.